Welcome to the deep dive. Today we're tackling a really important topic, though thankfully not super common. Adenocarcinoma in the gastrointestinal tracts of dogs and cats.
Hmm.
Now, I know diving into medical stuff can feel, a bit heavy sometimes.
It definitely can.
But think of this as us pulling out the key things you need to know. Our goal isn't to make you a vet overnight, but to give you some solid insights from the medical texts, make it clear, make it stick.
That's right. And honestly, while these tumors aren't something we see every day, just understanding the basics, that can be incredibly valuable if you own a pet.
Yeah, spotting potential signs early, even if the overall prognosis can be tough, it really could make a difference.
Absolutely.
Exactly. So our mission for this deep dive is to give you a good handle on what this condition looks like in our pets. From those first little hints that something might be wrong, all the way to potential outcomes. And we'll try to do it without drowning you in jargon.
Sounds like a plan.
Okay, let's dive in. When we talk about adenocarcinoma in the GI tract, what exactly is that?
Okay, so in simple terms, it's an uncommon type of cancer. It starts in the epithelial lining, basically the inner surface of the digestive system.
Okay.
And generally speaking, when this diagnosis comes up, the outlook, unfortunately, is usually considered guarded to poor.
Right. And are we seeing this pop up more in dogs or in cats?
The data we have suggests dogs are more commonly affected by this particular type of cancer in the GI tract than cats are.
Okay, dogs more often. What about age? Is it younger pets, older pets?
Typically, it's something we see in middle-aged to older animals,
Yeah.
so usually over 6 years old. Though the reported range is actually quite broad, something like 3 to 13 years old. But yeah, mostly older than 6.
Interesting. And for dogs, any specific breeds that seem more susceptible?
Interestingly, the sources we looked at don't really point to any strong breed predisposition in dogs generally.
Oh.
But there is a difference noted between the sexes. It seems male dogs are diagnosed more frequently than female dogs.
Got it. So older male dogs are maybe at slightly higher risk, but it's not really a breed thing. Okay. Now let's shift to what you, the listener, might actually notice. If your pet had this, what sort of history might you report? What might the vet find? Let's maybe break it down by location. How about the stomach first?
Okay, stomach. So historically, what you might report is vomiting, maybe loss of appetite. We call that anorexia, weight loss that you didn't intend.
Right.
Sometimes, unfortunately, vomiting blood, which is hematemesis, or seeing dark, tarry stools, that's called melena, and it signals digested blood.
Okay. Those are definitely concerning signs. And what would a vet find on exam?
Well, that's the tricky part with stomach cases. Often the physical exam findings are pretty nonspecific. There usually isn't an obvious lump or something you can easily feel from the outside.
So the story you tell the vet, that history becomes super important in that case.
Exactly. Very crucial.
Okay, what if the adenocarcinoma is in the small intestine instead?
Right, small intestine. The signs you might see there can include vomiting again, weight loss again too, but also maybe things like borborygmus.
That's the rumbling stomach sounds.
Yeah, exactly, those loud, gurgly gut sounds. Also, maybe more flatulence, passing gas, and melena, again, that dark stool.
Okay. And on the physical exam for small intestine?
There, the vet might actually feel something, potentially a mass in the mid-abdomen.
Ah.
They might also feel loops of the small bowel that seem distended, maybe painful when touched. And again, a rectal exam might reveal that melena.
Right. Definitely sounds like a set of signs that would warrant investigation.
You.
Okay, last location, large intestine and rectum. What would we expect there?
With the large intestine or rectum, the signs often center around, well, bathroom habits. You might notice mucus or blood mixed in with the feces, and something called tenesmus. That's where the pet is straining to defecate, even if there isn't much coming out.
Oh, that sounds uncomfortable.
It is, and during the physical exam, particularly a rectal exam, the vet might be able to feel a mass. Sometimes these tumors can grow in a ring shape, sort of encircling the inside of the colon. We call that an annular lesion.
Okay.
Or they might appear as multiple lumpy growths sticking into the colon. And in these cases, instead of dark melena, you're more likely to see bright red blood on the feces since the bleeding is happening lower down.
Gotcha. So it really highlights how where the tumor is changes what you see most prominently. Okay, thinking about causes. The sources say the exact triggers are unknown. But are there any suspected factors or things being looked at?
That's correct. Yeah, the why is still largely a mystery. However, the literature does mention nitrosamines. These are compounds that have been shown to cause these kinds of tumors in like experimental lab settings.
Okay, nitrosamines. Anything else?
Well, there's also a potentially interesting genetic angle. Specifically for gastric stomach adenocarcinoma, a possible link has been seen in related Belgian and Dutch Tervuren shepherd dogs.
Oh, really?
Yeah, suggesting that, at least in some specific cases, there might be a hereditary component involved.
That genetic piece in those breeds is fascinating, really shows how complex cancer is. Now, when a vet sees a pet with these kinds of symptoms, obviously adenocarcinoma isn't the only possibility. What other conditions need to be on the radar? What are the differentials?
Oh, absolutely. It's crucial to rule out other things, often more common things that can look similar. So the list of differentials would definitely include things like, did the pet swallow something they shouldn't have, a foreign body causing an obstruction?
Right, that happens.
Yeah. Inflammatory bowel disease, IBD, is a big one. Lymphoma, which is another cancer that often affects the GI tract. Parasitic infections need to be considered. Then there are other types of tumors like benign leiomyomas or malignant leiomyosarcomas, and even pancreatitis, especially if the signs seem linked to the upper abdomen or small intestine area.
Okay, so quite a list to work through. It's definitely not a simple diagnosis. Let's talk about how vets actually figure it out, the diagnostic journey. What tools do they use? Maybe start with basic lab work like blood tests.
Sure. Standard blood work, a CBC, a chemistry panel, a urinalysis can give some clues, but often they aren't specific enough on their own to diagnose adenocarcinoma.
Right.
If the tumor is in the stomach or the small intestine, we might see a particular type of anemia called microcytic hypochromic anemia.
Okay, what did that mean?
It basically means the red blood cells are smaller and paler than usual. It often suggests chronic, slow blood loss, maybe from the GI tract, leading to iron deficiency.
Okay.
We might also see slightly high BUN, that's blood urea nitrogen, that stays elevated, while another kidney value, creatinine, is normal. That pattern can also suggest bleeding happening somewhere in the gut.
Interesting clues.
But if the tumor is lower down, in the large intestine or rectum, the routine blood work often looks pretty unremarkable. No characteristic changes usually.
Okay, so blood work might point towards upper DI issues,
Yeah.
but not always definitive. What about other lab tests? You mentioned melena, but what about testing for hidden blood, fecal occult blood?
Yes, exactly. Testing the stool for occult blood you can't see, can be positive. But there's a catch.
Oh.
The animal eats can affect the results. Meat in the diet can cause a false positive. So vets often recommend repeating the test after the pet's been on a bland, non-meat diet for a few days, just to be sure the result is real.
Ah, that makes sense. Good point about the diet. Okay, let's talk imaging. X-rays, ultrasound. What can those show?
Imaging is really key here. Ultrasound can be super helpful. It lets us look directly at the layers of the stomach or bowel wall to see if they're thickened. Sometimes we can even see the mass itself within the GI tract. Ultrasound also lets us check the nearby lymph nodes in the abdomen to see if they look enlarged, which might suggest the cancer has spread.
Okay, ultrasound sounds very useful. What about X-rays?
Standard X-rays might not show much unless there's a blockage, but contrast X-rays can be informative. That's where the pet swallows or is given a contrast agent like barium that shows up white on the X-ray.
Right.
So with what's called positive contrast radiography, we might see a filling defect in the stomach where the contrast can't go because the tumor is there. Or in the small bowel, we might see space-occupying lesions or narrowed areas like strictures. It's worth noting, stomach tumors are often found in the distal part, the lower two-thirds.
Okay.
For the large intestine and rectum, a technique called double contrast radiography is often useful. This uses both liquid contrast and air to outline the inner surface really well, helping to highlight those polyp-like or ring-like masses we talked about.
Wow, lots of techniques.
And then, of course, for the absolute best, most detailed images of the GI tract, advanced imaging like CT scans or MRI, usually with contrast, gives the highest quality pictures.
Okay, so imaging gives a lot of information about structure and location. But for a definitive diagnosis, you usually need a tissue sample, right? Biopsies.
Exactly. Seeing the cells under a microscope is generally required. Now, how we get that sample can vary. If we see a suspicious mass or lymph node on ultrasound, sometimes we can do an ultrasound-guided fine needle aspirate, or FNA.
Okay.
Use a thin needle, collect some cells. This can be helpful, especially to rule out something like lymphoma, which often exfoliates cells well.
But it's not always enough.
Right. Sometimes an FNA doesn't get enough representative cells, especially with carcinomas. Another option is endoscopic biopsy using a camera scope.
Less invasive.
Less invasive, yes, but it has limitations. These adenocarcinomas often grow deep within the wall of the gut, sometimes under the surface lining. An endoscopic biopsy only gets a small, superficial pinch of tissue.
Ah, so it might miss the actual tumor cells.
Precisely. It can be non-diagnostic because the tumor is deeper than the biopsy forceps can reach. So quite often a surgical biopsy is needed. That means actually going in surgically to get a larger, full-thickness piece of the affected area that usually gives the definitive answer.
Okay, it sounds like diagnosis can be a multi-step process sometimes.
Yeah.
So once that diagnosis of adenocarcinoma is confirmed, what are the treatment options?
Well, the preferred treatment, really the mainstay, is surgical removal or resection, whenever that's possible.
Good.
And this is but it's rarely curative for these types of tumors.
Okay, why is that?
Well, location and spread are big factors. In the stomach, unfortunately, these tumors are often quite advanced by the time they're found, and their location makes them very difficult, usually impossible, to remove completely. So gastric adenocarcinoma is typically considered non-resectable.
Oh, okay. That's tough. What about the small intestine?
In the small intestine, surgery might be more feasible. It involves removing the cancerous section of bowel and then reconnecting the healthy ends. That procedure is called resection and anastomosis. However, even if the surgery seems successful locally, there's a very high risk that the cancer has already spread, metastasized to the regional lymph nodes or even the liver by the time of diagnosis.
So metastasis is a major concern.
A huge concern, yes. And for the large intestine and rectum, surgical removal might sometimes be an option, occasionally using a specialized pull-through procedure for rectal tumors. But again, metastasis is common. If complete removal isn't possible, sometimes a surgeon might do what's called transcolonic debulking, basically removing as much tumor as possible to relieve any blockage and potentially improve quality of life for a time.
So surgery is the main approach, but often with significant limitations and risks of recurrence or spread. What about other treatments, like medications? Is chemotherapy effective?
Yeah, that's the next logical question. Unfortunately, the reports on using chemotherapy for GI adenocarcinoma in pets are mostly anecdotal, meaning based on individual case reports rather than large studies.
And the results?
And generally, it hasn't been found to be very successful, unfortunately. It doesn't seem to significantly extend survival times in most cases.
Any other medications?
There is one drug mentioned, piroxicam. It's a non-steroidal anti-inflammatory drug, an NSAID.
Like an aspirin-type drug?
Sort of, yes, but a specific one. It seems it can sometimes offer some palliative relief, meaning it helps with symptoms, particularly for tumors in the large intestine and rectum. The dose usually mentioned is 0.3 milligrams per kilogram orally once a day.
Okay, so piroxicam for palliation, maybe?
Possibly, but regardless of whether surgery or piroxicam is used, effective pain management is absolutely critical. These conditions can be painful, so using aggressive, often combination analgesic plans is really important for maintaining quality of life.
Right, pain control is paramount. Are there any treatments that should be avoided or used with extra caution?
While the sources do advise caution, specifically suggesting consulting with a veterinary oncology specialist before using potent cytotoxic chemotherapy drugs.
Why is that?
Because of the potential for side effects and drug interactions, especially in an animal whose digestive system is already quite compromised by the cancer itself, you want to make sure the treatment isn't causing more harm than good.
That makes total sense. Okay, so if a pet does go through treatment, say surgery, what kind of follow-up care is needed? And crucially, what's the general outlook, the prognosis? Let's maybe talk about dogs first.
Okay, follow-up for dogs post-surgery typically involves regular check-ins. Physical exams, chest x-rays to look for spread to the lungs, and abdominal ultrasounds to check for local recurrence or spread within the abdomen.
How often?
The usual schedule suggested is at 1 month, 3 months, 6 months, 9 months, and 12 months after surgery.
Okay. And the prognosis for dogs?
Sadly, the overall prognosis for dogs with GI adenocarcinoma is generally considered poor.
Poor overall. Are there any exceptions?
The one relative bright spot seems to be for rectal tumors that are pedunculated, meaning they grow on a stalk, kind of like a mushroom. Those tend to have the best outcome after surgical removal.
Yeah, okay.
But for most other cases, particularly gastric and annular large intestinal tumors, and even many small intestinal ones, we often see rapid local recurrence of the tumor spread to other organs, metastasis, or both.
Can you give some specifics on survival times? I know they're just averages.
Yeah, they are just averages, but they give a picture. For gastric adenocarcinoma in dogs, the median survival time is reported as only around 2 months.
Wow.
For small intestinal adenocarcinoma, it's a bit longer, maybe around 10 months median survival. For large intestinal tumors, there's that stark difference we mentioned. The annular, ring-like ones have a median survival of maybe 1.6 months, really short. But those pedunculated rectal tumors, the median survival reported there is much longer, around 32 months.
That difference between the annular and pedunculated rectal tumors is huge.
It really is. It underscores just how much the specific location and the way the tumor grows can influence its behavior and the ultimate outcome.
Those are sobering numbers for dogs mostly.
Yeah.
What about cats? You said it's less common, but what's their prognosis like?
For cats, the prognosis is also considered guarded. As you said, fewer cases are reported in the literature compared to dogs. But the information we do have suggests that cats might potentially have longer survival times than dogs with similar tumors. Some reports mention cats surviving for over a year following diagnosis and treatment.
Okay, so still very serious, but perhaps a slightly better outlook potentially in cats compared to the average dog case.
That seems to be the suggestion, yes.
Well, this has certainly been a detailed look, but hopefully, as we aim for, a clear one into gastrointestinal adenocarcinoma in pets.
It's a tough topic.
It is. And while the information is complex, again, our main goal was just to give you a better understanding of this condition, even though it's relatively uncommon.
Absolutely. And I think a key takeaway for you listening is really just to be observant. Watch your pet for any of those persistent signs we talked about, the vomiting, weight loss, changes in stool, straining.
Right.
And don't hesitate to talk to your veterinarian if you have any concerns at all. Early detection is always best, even with challenging conditions.
Exactly. And as we've heard, diagnosis isn't always straightforward. Treatment has limitations. It really drives home the need for expert veterinary care if this disease is suspected.
Definitely. And, thinking about those widely different survival times, especially in dogs, between, say, an annular rectal tumor and a pedunculated one, or even between small intestinal and gastric,
Yeah.
it really makes you wonder, doesn't it? What are the underlying biological reasons for those dramatic variations? What makes one form so much more aggressive than another in almost the same location? And perhaps more importantly, where could future research go to understand these differences better and maybe, just maybe, find ways to improve those outcomes for our pets?
Those are absolutely the crucial questions for the future, something important to think about. Thank you for joining us for this deep dive. Until our next exploration.